Hi, my name is Breona Carter, and I am a certified nurse midwife at Adriatica Women's Health. Today, I would like to discuss the topic of newborn male circumcision. A circumcision is the surgical removal of the foreskin on a newborn male. It is routinely done in the hospital the next day after the baby is born, as long as he is healthy. Babies have to be seen and cleared by the pediatrician prior. They must receive their vitamin K injection to prevent bleeding, and they have to have voided at least once prior to the surgical procedure. A circumcision is an elective and cosmetic procedure. It is not universally recommended for all baby boys by the American Academy of Pediatrics. With anything that's elective and cosmetic comes its own set of risks: bleeding, infection, removal of too much, too little skin, or damage to the head of the penis that later has to be re-repaired. Risks themselves are considered relatively small. The benefit of circumcision include a decrease in the risk of UTIs for the first year of life, a decreased risk of STDs later in life, and a decrease in the risk of penile cancer. For the surgical procedure, lidocaine is injected at the base of the penis to numb the area. The area is then sterilely prepped and draped before the surgical procedure starts. The penis itself is covered with a surgical instrument, and then removal of the foreskin takes place. The circumcision itself usually takes about 5 minutes. Babies are usually away from their parents for about 30. Following the procedure, the nurse will bring the baby back to the room so we can observe the penis. The care after the circumcision is just as important. It's critical that you apply a petroleum-based gel at the head of the penis with every diaper change. You can also apply a sterile gauze to prevent irritation. This should be done with every diaper change for the full 6 weeks after the circumcision. It's also important too that you take the foreskin and pull it below the head of the penis to allow for proper healing. Following these steps after the circumcision are critical, and they are essential for allowing the foreskin to heal below the head of the penis. Overall, circumcision is considered generally very safe. If you have any questions or concerns, feel free to reach out to your provider at Adriatica Women's Health.